Taking part in sports and physical activities is an important part of a healthy lifestyle for kids. But injuries can and do occur. We talked with Dr. John Schlechter and Mollee Smith, physical therapist, both of Children's Hospital Orange County, about preventive measures that can be taken.
Early specialization and lack of diversification is what we're seeing more and more commonly now, where children are going into one sport, a single sport early on. I just had a 6-year-old motocrosser in my office yesterday on a motocross bike. So they go into a sport and they stay with that sport without changing, and they're cross training. Back a few generations ago, or even in my generation I would say, we would play multiple sports, so you would go from one season to the next, so basketball into baseball into football, and maybe even throw a little swim or some rest in there. But with early specialization we have 6-year-old professional athletes, and they keep going until unfortunately some of them get injured. It's interesting how it's different from one patient to the next. So what could cause an overuse injury in one 10-year-old may not cause the same overuse injury in another 10-year-old. And I think a lot of that's developmental. I think children and adolescents develop at a different rate. So a 10-year-old is not a 10-year-old is not a 10-year-old. So some people can get an overuse injury after 2 times doing the same sport. Other people, it might take them 6 months. But I think in general, it's this lack of rest, chronic repetitive stress that leads to the overuse phenomenon.
I have noticed in our practice that youth sports injuries have grown tremendously. Our practice has grown. Private practices in Southern Orange County see more youth injuries because there's such a growing involvement of children in youth sports from a young age to adolescence to college. When these injuries occur, it's a very delicate dance with the family and the child, who's the patient, because we're not just treating the patient, but we're treating the family. And the family may have goals and aspirations for their child, or they may have a certain philosophy in the home. So we need to work with the family, and the child is the family unit as part of the rehabilitation. And our approach at CHOC is that we support the athlete and the family in their endeavors, and we try to provide them with all the information so they can make the best decision for their child. But we do provide the pros and cons to continuing to participate versus resting versus rehabilitating and resting. So we try to provide all sides of the story so that the family can make the best decision.
My typical approach to prevention is rest and diversification. I think in most sports, especially as children and adolescents go into early specialization, they play year-round, maybe with only a day off for a holiday, let's say, and they're not getting the adequate amount of rest. In general, we like to preach, or I like to preach, 3 months of rest from the sport. So the next question the parents always ask is, does it need to be 3 months in a row or 3 months spaced out? I think 3 months in general is a good rule. I think in a row makes a lot more sense to me, because if you look at injury healing throughout the human body, it usually takes about 12 to 16 weeks for an injury to fully heal. And if we're looking at some of these overuse syndromes or injuries as true injuries, I think it makes sense to me to give it that full straight 3 months. And my overall philosophy of care is to try to treat them first as a human being, second as a student, and then as an athlete.